Well, hello, everyone, and welcome to our program on pandemic parenting, supporting teen mental health. My name is Susan Weinstein, and I am co-executive director at Families for Depression Awareness. We are very pleased that you've taken the time to join us tonight, so thank you. I have a couple of announcements to start with. We expect that this webinar will run about an hour and 15 minutes or so. We will try to take as many questions as we can, so it may go a smidge longer. But we will send out a link to the recorded version of the webinar to all registrants, and you'll be able to access the webinar on demand at your convenience. It also means that you could share it with other people, but it will be available through our website as well. For this webinar, I would suggest that you open up your chat box because we will be dropping in some links of interest, and anything that Dr. Basu is talking about that has a link, we'll be sharing those with you as well. So for the question and answer, please use the question and answer box. The chat box will only be available for you to receive information, not to share it. So we know that many of you have submitted questions in advance, and we thank you for those. But you are also welcome to drop in your questions anytime during the webinar, and we will get to as many as we can when we get to the Q&A section at the end. And then after the webinar, please do take a few minutes to answer our survey. It's really important to us to get your feedback on what was good, what we could improve, and what kinds of actions you think you'll take as a result of watching this. We really want to be inspiring people to take action, to support teens in their lives, and also, of course, to take care of yourselves. To encourage you a little bit more to take the survey, we are going to be giving away a few copies of a book called A Still Quiet Place for Teens, a mindfulness workbook to ease stress and difficult emotions by Dr. Amy Salzman. She did a program for us that you'll find, I think, in our library on our website. But it's been a very popular book among the people that we've shared it with. And so put in your survey, and hopefully we'll pick your name and be able to send it to you. Regardless of whether you get the book or not, please do participate. We really value your feedback. In addition to the webinars that we do over the course of the year, we also frequently post new articles and interviews and other sorts of educational and inspirational materials. You can keep up with all of that by subscribing to our newsletter and by following us on social media. I would recommend particularly Facebook and Twitter. We're at Family Aware. We also have a YouTube channel at FFDA1, and we have an Instagram account at Family Aware Teens. So check those out, be part of our vibrant community. Then the other way that I hope that you will consider supporting us is through a donation. The easiest way to do that is through our website, and your money helps us to do programs like this. This has been a tough year for everyone we know. We hope that your families are safe and healthy. As we're looking forward to the end of the pandemic, we still have the opportunity to put some really positive practices into place with our families. So I hope that you get lots of inspiration from this program. For our agenda, I'll speak for a couple of minutes about FFTA, and then I'll pass it over to Dr. Archana Basu, who will talk about conceptual model of development and mental health, about COVID-19 as a traumatic stressor, mental health as dimensional, COVID-19 for US population mental health for teens and parents, a little bit about building resilience, and then we'll get to that all-important Q&A. With regard to Families for Depression Awareness, we help families recognize and cope with depression and bipolar disorder to get people well and prevent suicides. Our philosophy is that depression and bipolar disorder affect the whole family. Everyone may have their unique needs. Even if you're not the person with the diagnosis, you are affected, whether it's that you're doing more work or you have more concern, or whatever it is to keep your family together. So we urge you to get the support that you deserve and need. Our teen depression program, of which this webinar is a part, We started in 2010, and since then we've trained more than 30,000 people. It's really important to us to get the message out about teen mental health and suicide prevention. So we have webinars in Massachusetts. We offer in-person when it's not a pandemic, but otherwise virtual workshops in Massachusetts. We have this great group of volunteers who are between the ages of 14 and 25-ish that are teen speakers who talk about their own experiences with mental health and getting well. We have teen videos, family stories, and expert interviews on our website. And we recently tested a panel of parent speakers that went very well. So we're looking forward to implementing that as well. Our website, you probably have seen at familyware.org, but it's layers and layers rich with resources. There's such a wealth of information. We really pride ourselves on the quality of the information that we share. And I always say, if you can't find what you're looking for, use the search bar. Among the things that we have online are our free web tools. We have this caregiver stress test that's new as of last year. So it encourages you to take steps to manage your stress better and gives you some real practical tips on how to do that. So go check that out. We have a series of educational webinars. We've been building out our library so that all of these remain available for people to watch rather than just, for a period of time. If you have not yet watched the Understanding Teen Depression program, I really urge you to do it. Mary Freistad is a member of our advisory board, and she just really manages the material very, very well. We have these interviews and stories so that you can be inspired by other people's journeys and learn from their experiences. And if you are ever inspired to share your own family story, then please do be in touch with us. We have a few publications that we've been working on recently, and they're good reads, I'll put it that way. But most of them combine a bit of education about either depression or bipolar disorder or caregiving, along with some insights from people's personal experiences. And regardless of where you are in the country, you can order custom teen resource cards to share with people in your community. They fold up, they can fit in a wallet or the back of a phone case, and it gives teens some resources and ideas of what to do if they're not feeling well, and you can customize it with resources in your community. Whoops. And I just want to congratulate you that you really are doing the right thing by tuning into this webinar. Teens who have a trusted, caring person in their lives that they can turn to, who knows about depression, knows about suicide prevention, are far less likely to attempt suicide. And so knowing this information, knowing how to communicate with teens, all of that is important. And you do play a really critical role in suicide prevention. So thank you for taking the time to do this. And now I am thrilled to be able to introduce our featured presenter, and that is Dr. Archana Basu. She is a psychologist and instructor in the Division of Child and Adolescent Psychiatry at Massachusetts General Hospital and the Harvard Medical School, and she's a research scientist in the Department of Epidemiology at the Harvard T.H. Chan School of Public Health. She conducts research to understand how childhood adversities and protective factors shape children's health and development and affect both mental and physical health. As a practicing psychologist, Dr. Basu works with children and families to promote coping and resilience in the context of trauma and bereavement. And I am just thrilled to pieces to have you here. So I will turn it over to you.
Thank you, Susan. Okay, if you could just give me a thumbs up that you can see the slides. And I'm just gonna, yeah, okay. So thank you again, Susan and FFDA, for having me today. And thank you all for joining us. I'm looking forward to talking with you. I had the opportunity to look over some of the questions that you sent in advance, and I'm looking forward to having more of a discussion after the presentation. I'd just like to begin by acknowledging that I have no financial conflicts of interest or anything relevant to disclose. So I'd like to begin by just sort of providing an overview or framework of how I think about child and adolescent development and mental health, because I think it provides an important context to some of the more specific skills or communication tips or coping habits that we'll be talking about. And, fundamentally, my view, and I believe the preponderance of the research base, really speaks to the idea that development is inherently systemic, meaning that, while there are certainly individual factors like individual strengths and challenges, we have unique personalities and temperament styles. And certainly a child or person's age and developmental stage really matters. We don't grow up in isolation. We live, work, play in the context of interrelated systems. And this might include, of course, importantly, a family system. It might include the schools or colleges, workplace environments, but also other systems and communities like faith-based communities, for example. And then at a more broader and sort of macro level, we might consider policy-related factors as also systems that provide a context for this development. Each of these systems, I believe, sort of interact with each other and ultimately influence our experiences. And I think in the context of the pandemic, just as there might be disruptions in any one of these systems that might ultimately affect us, the reverse is also true, which is that each of these systems provides an opportunity for us to intervene, to support and promote resilience. In essence, I think the biggest take-home point is, coping and resilience are things, it's a process, first of all, and that it can be built by supporting any one of these layers or systems. And it's not just about an individual's coping skills, although there are things that we can do individually, certainly to support ourselves and our families. The last element that I'd like to highlight is the idea of history or time. And what it really stands for here very briefly is that, each of us is coming to this experience of the pandemic, not only with our own unique individual histories, but also because we all belong to different communities, whether it's racial and ethnic groups or gender identity or sexual orientation, or any other sort of group that we identify with that has a certain history that is both individual, but also societal. And so how we are receiving some of these experiences and affected by some of these policies and interventions and responses across community level sort of factors also varies based on our unique historical context. And time is actually a very important element when we think about recovery and resilience. So this is a model I'll touch upon a couple of times, but this is essentially the framework, and I'll talk more about these elements throughout the talk. In terms of teen development, although this might seem like a pretty obvious thing, I do like to point out up front that when you think about teen development, we're talking about actually multiple fairly different sort of age groups. So there's certainly younger teens and tweens, and where one might be cognitively and emotionally might be different than where we are chronologically, but there's sort of a younger teen age group. Older teens who are very much closer to transitioning to adulthood. And then young adults who might be sort of legally adults, but neurobiologically speaking, their brains are still developing. And we know that at least until our mid-20s, the brain is still sort of an adolescent and developing brain. So, it does span quite a range in terms of age and development. And I will try to sort of speak to some of these nuances as I, talk and present today. And then also to recognize that cognitively speaking, while teens are, youth are certainly able to process information in ways that are very similar to adults, emotionally speaking, they still need a lot of support and connection, which is true really for all of us across the lifespan, but is also certainly true for teens, which can sometimes be a challenge because they're also, of course, psychologically speaking, exploring more independent and autonomous sort of functioning, trying to develop their own sense of identity. And, we see this certainly in terms of thinking about, say, who am I going to be as I think about whether I'm going to go to, whether I'm going to go to college, what am I going to study, what kind of job do I want to have, who am I really going to be on my own? And thinking about that in terms of also relationship choices, because it's a period of, tremendous transition, going sort of from a family of origin, if you will, the birth family or the adoptive family, to a family of choice, really choosing who they want to partner with in terms of partner relationships and close friendships. So with this backdrop, I guess I will say very quickly, because a lot has been said about this, but I think it's worth highlighting that COVID-19 is a complex traumatic stressor. And there are lots of definitions of trauma and what is potentially traumatic. I have this particular definition I like because I think it's particularly developmentally sensitive in that a traumatic event is an experience that we know can cause physical, emotional, or psychological distress or harm. But I do think it's not just about a threat to one's own safety, which is what the majority of how trauma is understood to be, which I think is absolutely the case. But I also think that a threat to the stability of one's world is also potentially traumatic. And I think this idea of stability is really, really key in terms of thinking about building in supports for teens and youth. So if you look at the COVID-19 pandemic, it is a complex stressor. And these are some responses that sort of highlight why I speak of it as a complex stressor. And these are responses that I've actually gathered over time in giving sort of more public education talks such as this one. And this has been over the span of kind of 1 year, where I've had sort of interactive audience conversations, generated word clouds, or solicited feedback about how people are experiencing the pandemic. And in some ways, it's sort of, if you look at sort of the way they're listed, is sort of how these themes have evolved, which is to say, the novel elements and the viral risk were some of the first things that folks highlighted, the unpredictability and lack of control in this rapidly developing landscape of the pandemic, the sense of closures, disruptions, and isolations, lack of clear horizons. I think after the viral disease impact, soon after, there was a lot of conversation and experiences of instability, economic impact, job transitions and losses, and along with the growing recognition of stigma and discrimination associated with the virus itself. We have experienced and witnessed a tremendous amount of loss and grief and bereavement. And these losses are both big and small. People have talked about very visceral experiences, in terms of the isolation and loss, such as the lack of touch, the lack of connection with their loved ones, not being able to travel, but also feeling like we are sort of constrained in our own boundaries with this onslaught of information that feels like doom scrolling. And along with this, in this past year, there has been a lot of social and political upheaval, certainly in the United States, and that has been a theme that has come up in several conversations. So it's a fairly complex landscape. And so what does this mean, and how has this started to play out sort of the US population mental health level? So, I'm sure that all of you have been reading and hearing a lot about this. So I just wanted to touch upon it really to provide some of the most recent data that I had access to. So most recently in March, a New York-based nonprofit, FAIR, developed a white paper where they looked at private healthcare claims filed on behalf of individuals, children through young adults about age 22. And they looked at basically healthcare claims filed in 2020 between January to November and compared it to the previous year. And the upshot is that mental health claims, in contrast to medical claims, which went down, mental health claims actually rose dramatically, particularly in March and April. And these claims for teens in particular, so 13 to 18, basically grew about 100% in this March-April timeframe. And then, although there was a sort of plateau there tended to be an increase in claims all through the year. Another survey, the other survey that I have listed over here from the University of Michigan, surveyed about 975 parents about their teens and youth, and nearly half of them said that their children had been showing new or worsening signs of mental health since the pandemic started. Of note, other data, such as from the Kaiser Family Foundation, has shown that the youth and young adult sort of concerns are pretty unique. Which is to say that it's not that they weren't concerned about the viral disease impact or the increase in death and bereavement, but just to say that in terms of the primary and salient issues that this younger age group highlighted, they were most concerned about the economic uncertainty and the isolation that they were experiencing. It is important to note that overall, older teens and young adults have been identified as experiencing some of the highest levels of distress during this pandemic relative to all other age groups. And so I think this really speaks to the importance of supporting teens and young adults, as well as the systems that support them. And I'll say more about that. And in terms of the systems that support teens and young adults, of course, thinking about, immediate family, we really saw the impact very early in the pandemic. These are data from fall of last year that were from surveys conducted by the 3 institutions listed over here. And, parents, and when I say parents, I'm really talking about parents as well as any consistent caregivers who are taking care of children. Parents in a majority of households reported significant childcare problems and problems supporting their children, which included challenges in supporting their educational needs, as well as, balancing their own employment and work-related demands. And over time, most recently in March, there was another survey from the American Psychological Association, where they found that parents with children age 18 and under were more than twice as likely as a non-parent adult to have worked with a mental health professional. They found that about 75% of parents said that they could have used much more emotional support than they received. About 33% received treatment from a mental health professional, and 25% were diagnosed with a mental health condition since the pandemic started. There were some differences between, mothers and fathers. The surveys actually, it's public access. They also found, associations with changes in physical health for parents. And so really sort of a broad spectrum impact parents, one of the primary support systems for children and teens. Within parents and sort of the caregiving, group, single parents, and mothers and women are particularly have reported high levels of mental distress. We know that, for instance, the economic impact in terms of job loss and job transition has been particularly pronounced for women in particular. Healthcare workers, frontline and essential workers, as well as members of under-resourced communities have felt very unsupported and are reporting high levels of mental distress. I think we've all heard and read about extensively the emerging, ongoing kind of stories and statistics on the impact on racial and ethnic minority communities, Black, Indigenous, and individuals of color. And you can see here, this is some of the recent data from the CDC that shows from the start of the pandemic in March of last year all the way through March of this year, the cumulative rates of COVID-19 associated hospitalization by race and ethnicity highlight sort of the burden of death and disability from COVID-19 infection on minority communities. Many of these communities have also suffered some of the greatest economic losses and have had increased risks in terms of viral exposure because they are more likely to have had frontline essential jobs, more likely to have had pre-existing health conditions, which in my mind really speak to the existing structural inequities in our society. And also fewer buffers and access to factors that promote coping in the pandemic, including things like access to reliable internet, access to green and blue spaces. So the opportunity to be out in nature in ways that allow us to be socially distanced, but also to maybe exercise or recreation. And then also access in terms of healthcare has been more limited relative to other racial and ethnic groups. And I think that this context is important to consider as we think about rebuilding and resilience and recovery. So I'll come back to this as I talk more about resilience. So moving on to sort of, mental health, I'd just like to make a quick point that mental health is really a dimensional construct. We often, including in the statistics that I noted, we tend to talk and think about them as, someone has a mental disorder or doesn't, but outside of, healthcare claims, we know that mental health is really a dimensional construct, which can, stem from well-being all the way to, very more serious psychosocial disability that requires a lot of intensive support. And I highlight this just for a couple of reasons. One is that, all of us at this time in this prolonged period of stress and isolation and deprivation, in general, at a population level, with maybe some exceptions, most of us, stand somewhere in between mental distress to psychosocial disability. It also, this is sort of a shift that we would expect to see because these are very unusual and difficult periods and experiences. And so, some amount of distress is not only to be expected, but also something that we need to normalize and support each other through. But it also speaks to the types of interventions and supports that we might seek depending on where we find ourselves or teen and youth to be. The second thing that I'd like to highlight over here is that, across the course of the pandemic, we might find ourselves in different places along this. And so this is not something that's stable. It's not something that is permanent, but something that is malleable and might shift. And so what are things that we might watch for? In terms of the mental health kind of symptoms, You've probably seen many or all of these behavioral sort of symptoms in many places, but I wanted to list them here again. And again, some of these are things that we see even outside the pandemic as part of typical development. So certainly like irritability, feeling annoyed, having memory or concentration problems. Those are things that you would see at, really at any point on any day. So what we're really looking for is what to watch for in terms of our children and our teens is, a constellation of these symptoms. So if it's a couple of these symptoms, you might keep a close eye on them. But if you start to notice many of these, especially for, over a long period of time, then certainly seeking help would be very key. So we're talking about, mood-related changes like irritability, cognitive changes like memory or concentration problems, loss of motivation for school and learning, something that's really, really common in the, certainly this hybrid and remote schooling era that we hear about for many children, having poor hygiene, somatic or physical symptoms like aches and pains, sleeping too much or too little, changes in eating patterns. And I think importantly, the last two, so things that our teens or children liked doing, but are not able to enjoy quite as much or don't seem to be doing quite as much, those are definitely things to, keep a very close eye on. And so, what are some additional factors to consider as you're thinking about these, potential behaviors or symptoms that you might be observing, in addition to if there's a constellation or a number of these, or if they are ongoing for a longer period of time, would be if there was a pre-existing history, right, of mental health difficulties. If the experience for you or your family or for your child in the pandemic, so a direct viral disease that has been associated with medical complications, certainly bereavement or loss of a loved one, and also for your family or community, if you have suffered significant economic impact, instability, residential instability, for example, or perhaps someone in your family or your teen has an existing medical condition that puts them at a higher risk for developing medical complications. These are some of the factors that might increase the risk in terms of, experiencing mental health concerns. So if you're wondering about, when to get help, I would, like I said, a pattern of problems that might be, more than a couple of those behaviors or symptoms I highlighted earlier, that have been ongoing for, more than 2 weeks, 3 weeks, 4 weeks, that you are starting to know, because by that time it starts to affect some aspect of their daily life. It might be their relationship with their friends. It's quite likely already, showing up in their interactions with you. It's likely to be affecting their motivation and engagement in school-related activities, or if they've had a job in the pandemic, which has been less so in my experience, but certainly with school-related learning. That would be a time when you'd want to reach out to your primary care doctor for your child, and at least get an initial evaluation. Certainly, if you are noticing any high-risk behaviors, so for example, substance use related issues or concerns, any self-injuring behaviors, that is a time when you must reach out immediately. And if you are concerned about suicidality, that is a time when certainly, not leaving the teen alone, seeking help immediately and emergently by calling 911 or going to the nearest emergency room is critical. But going back to that idea about dimensional, like mental health being on a continuum or being dimensional, even if your teen, your child doesn't have a diagnosable mental health condition, you as a parent might still be concerned about your child, because the impact of a prolonged stressor or a potentially traumatic stressor not only impacts us in terms of these behaviors or symptoms and motivation to, for school and for friends, it also sort of fundamentally shifts our beliefs about safety and predictability, our sense of hopefulness about the future, because we lose our sense of control, autonomy. The idea, the sense of fear and instability is often much greater. And those are also things that, your teen might want more, might certainly need, but also want more support for. So recognizing that even in the absence of a mental health condition, that there are all types of losses and elements related to fear and instability that your teen might need support for, I think would be really key. In fact, one of the reasons I highlight that is also because if we look at the previous research from mass disasters like Hurricane Katrina or the 2008 economic recession in the US, what we find at a population level is that the majority of children and adults don't go on to have long-term diagnosable mental health disorders. It doesn't mean that they're unaffected completely or don't need support. It's just that they don't have diagnosable level of mental health disorders. So the current distress that we are hearing about and experiencing is likely to improve as and when a sense of stability and safety is established. And that's, speaks to our capacity both to adapt and sort of also the idea that inherent in development is this idea of change. Children in particular are really adaptable, but they might be both. They might be adaptable and need additional support. So establishing realistic expectations in terms of when to seek help, in terms of what types of change to experience, even as things normalize, is really key. So I would say that, even as things improve, all of us, including ourselves as parents, as well as our children, we're likely to be still coping with grief and sadness and exhaustion and fatigue. In fact, many of us, I think we actively engage in an adaptive type of sort of compartmentalization where we are not always fully processing the impact of what we are going through day to day. We're really just trying to get through the day. And trying to support our loved ones and trying to hold on to our jobs. And so I think as time progresses, we will truly start to allow ourselves to experience a lot of what we're holding on to, and acknowledging and recognizing the impact of this communal trauma will take us some time. And I personally think that, at least for 2-3 years and really much longer than that, we will be learning so much more about the mental health impact for our children and youth. So, moving on to sort of the idea of, so we have a sense of what the mental health landscape is like right now, about a year into the pandemic. How do we think about building resilience? How do we look towards the future and think about recovery? And I'd like to talk about sort of things we can do at individual levels, but also as, family members, as members of different communities and schools, or in terms of influencing policy, by first actually just saying briefly that, resilience can be defined in many different ways. And there are a couple of points that I'd like to make about that. Broadly speaking, resilience can be thought about as our capacity to adapt psychologically to a stressor or a crisis, and return to non-crisis levels or pre-crisis levels relatively quickly or without, relatively significant impairment. So some of the things to highlight here is that resilience doesn't always look good, like it is a messy process. It is not something that we are or we're not. Like very often you'll hear he or she or they are very resilient, as though it's just something that we're born with. It's just a trait that we have. And that while there's certainly personality and temperamental sort of dispositions that, in a certain context might be very adaptive, fundamentally, the preponderance of data and science tells us that resilience, at least partially, is a process. And this means that we can build it. It's actually, there are ways that we can build in resilience for ourselves and our loved ones. And as part of doing that, we are likely to learn new ways of coping. But as we are going through that process, on any given day, we may not look like a put together, resilient person all the time. The second thing I'd like to highlight, and this I think is a really common experience, which is that, you might find that your child is doing pretty well in some ways, but not other ways, which is to say that they might look resilient at times. So for instance, 2 days ago, I was talking to a mom who was explaining to me that, after some initial adjustment challenges with the sort of hybrid and remote model of schooling, her daughter had actually been able to, had started to cope pretty well with school-related demands in terms of, academic goals. But she was still really concerned in terms of her mood functioning and just, the way that her daughter seemed to be, feeling and talking about feeling very hopeless. So if we really look at, how she's doing in school, she might look like a really resilient person, but there was ample sort of other patterns that, mom was talking about and observing that I think appropriately described that her daughter still needed support in other ways. So I'm going to talk about resilience in about sort of 2 to 3 of these layers. And I'll just preface that by saying that some of the individual level factors, like individual behaviors that we can do in terms of coping, either for ourselves as parents or things that we might join our teens in doing, or that our teens can do to support themselves, are individual behavioral skills that I'll touch upon briefly, but won't go into too much details. But I'll talk a lot more about family communication, as well as engagement with community and policy a bit more. But in my books, resilience is really built upon repeatedly experiencing connectedness during adversities. So what I like to say is that responsiveness builds resilience. When we experience connectedness during periods of adversities, that's what makes these stresses tolerable rather than overwhelming, isolating, or toxic. And Susan talked about this right at the beginning when she described that for a teen or child, knowing that they are, supported and connected to a safe, attuned caregiver is one of the biggest protective factors that protects teens and children from suicidality. So that is one example of that. And in fact, the research on this is really consistent across many different contexts, that children of all ages need responsive caregivers to understand and cope with stressors. And the presence of at least one consistent, attuned, safe caregiver is one of the most powerful buffers for children. Related to this, parental coping is one of the most robust predictors of children's adjustment. And this, to me, speaks to a couple of different elements, but what the one take-home message is, we're great about supporting our kids, and we're often more willing to do for them, more things than we're willing to do for ourselves. As parents and caregivers, we tend to prioritize our needs, if at all we think about it, pretty much at the bottom of the list after we've taken care of our kids and maybe extended family and our job-related demands, among other things. But I'm going to sort of try and bring back to our intentional awareness the idea that when we support ourselves, we are also supporting our loved ones and our children in particular. So, there is, and in fact, I found some data that I wanted to share with you from the pandemic, because data on this is still emerging. But this is data from last summer, which was collected from about 1,500 teens, where families and teens were asked about their mental health, family time, sleep, and technology use. And this was part of an ongoing longitudinal study. So the researchers had data from several years prior as well, and had, an understanding of what the teens' mental health was in, 2018 based on the self-report, and prior years as well. And so these are 8th, 10th, and 12th graders that they sampled. And as you can see here, among teens who reported that their families became closer during the pandemic, they reported the proportion of teens reporting depressive symptoms was significantly less than those who didn't. So I think this speaks to what I was talking about earlier in terms of, family and, close caregivers being a protective factor for children's mental health. So in terms of individual coping, and this is individual coping that, we can do for ourselves as parents and caregivers, but also we hope that our teens will do for themselves. And what we know is that children are much more likely to do as they experience than what we say. So really anything you practice is much more likely to happen even for your teens. And so really, this is an individual sort of, things that we can do individually, but for me, it's part of a family's coping toolbox. And in the ideal scheme of things, parents and teens might be doing all of these things for themselves and often together as well, or at least talking about it together. I'm not going to go into a lot of detail on each of these, in part because I know that many of you have been thinking, hearing about this, and know about this anyway. But just to say that the evidence base in terms of sleep health and its impact on emotional and mental health impact in terms of cognitive functioning, physical health is just, it is pretty unequivocal. And so if there are sort of 2 to 3 behavioral things that we can control and do for ourselves, I would definitely highlight sleep, exercise, and spending time in nature, which is both something that if you can do safely while distancing, then things like going for walks, hiking, and access to green and blue spaces, which is sort of being in nature or around water, they have profoundly therapeutic impact. Exercise as well, as it affects mood functioning, immune system, and cognitive functioning. And at any of those levels, it also affects, improves our sort of psychological functioning. One of the things that I often hear about from families is that, it's really hard to go out and exercise. And I would just say, start small. And we can talk more about this in the Q&A, but even if you start with going for a walk for 2 to 3 blocks, or a short walk for 15 minutes and doing it every other day maybe, or twice a week at first, even a little bit goes a long way. And thinking really about building into your routine brief periods of time where you could perhaps build this in would be really, really key. Obviously with sleep, I think, napping is probably not recommended, but I know many of us are doing it. But I will say that for teens in particular, we know actually this has been something that many teens have reported has improved during the pandemic. And the reason for that is because school often starts earlier than, when most teens are sort of would typically wake up. Many teens have reported that even though they might be sleeping late, they're also able to often wake up late. So for some teens, I know this has improved, but the key thing here would be to establish good sleep hygiene, trying to get 9 to 10 hours of sleep, and maintaining that routine in terms of the schedule, even if they're sleeping late and waking up late, but at least getting that good quantity and quality of sleep would be key. Being intentional in building that routine to get that good sleep, especially in terms of, creating a space and routine away from screen time. I think that's often the biggest challenge, and I'll touch upon that a little bit later. In terms of other individual coping skills, behavioral relaxation, which is really connecting with your breath and breathing deeply, often called belly breathing, or progressive muscle relaxation, are really, really powerful. I can tell you that I myself build this into my routine very intentionally, even if it's for a 5-minute break, doing it at least twice a day. And the sort of simplest explanation for the power of this type of behavioral relaxation is that as we are constantly in this, place of feeling stressed out or burnt out, feeling like we are in a sort of flight or fight mode, which is what we are in often in terms of, responding to stressful situations, our nervous system is essentially in a very reactive place. And we are often sort of breathing in a very shallow manner, and often you'll find yourself breathing from the chest, taking shallow breaths. What behavioral relaxation techniques, including things like deep breathing and diaphragmatic breathing, do is they really bring our intentional awareness to slowing down our nervous systems, de-escalating that reactivity, so that our experience and capacity to respond physiologically is much, much greater. And these are truly powerful, and can often be done in sort of, 5-minute or 3-minute bursts even. I know some parents and even teens have talked about how if you wear one of those smart watches, it'll tell you if you've been sitting too long, it'll prompt you to take a deep breath. So if you have, one of those devices, or if you have an app that you like to use, those are very, very helpful to do. Mindfulness, similarly, is another really powerful sort of individual coping tool. And I believe there have been previous speakers who have talked a lot about this in their own talks. And I know Susan mentioned the mindfulness workbook for teens from FFDA. And there are also resources for adults in terms of thinking about how mindfulness can be fit into our busy schedules. I would highly recommend any of these resources. And because there's a lot of information on this from FFDA, but also in general online, I'm not going into a lot of, and sort of I thought about doing an experiential exercise, but in the interest of, giving you access to that and talking about other things, I'm not going to go into it. But except to say that mindfulness is another such powerful individual tool that really as long as you're building it in for even brief periods of reprieve into your day, it has the capacity to really help us shift our attentional awareness to how we are feeling, how we are responding rather than hopefully reacting, and really physiologically and psychologically getting us to a place where we can cope much better with this constant onslaught of demands that is on us. One quick resource to mention here is the website that I've listed provides a list of useful apps that you can use with sort of, independent reviews that you can look at to choose. In terms of, media use, this is a common concern for, teens and families. And I would just say, I think our goal is to really start and stay informed without getting overwhelmed. Certainly in the pandemic, it's been a real priority to, be connected about the evolving situation with the pandemic. So helping our teens identify trusted news resources, ourselves looking, especially for, I would say, younger teens and kids, looking at websites such as Common Sense Media to really look at, whatever social media, gaming, or other websites that they might be using can be really, really helpful. One of the things that we know has happened in the pandemic is a huge spread of misinformation. And I think, joining our teens in conversations about, what they're hearing about, clarifying misconceptions, while also protecting their healthy curiosity and natural proclivity to learn more and be more independent while doing so, can be very helpful. A common question I get from parents is about gaming. I'll say two things about gaming and social media in particular, which is that these are obviously very important social tools for our teens. And in fact, in this period of physical distancing, technologically staying connected with friends and family has been touted and is one of the primary ways for us to stay connected. So part of what we want to think about is certainly what is the quality and types of things that kids and teens are using or being exposed to, and then thinking about, are there other things they're doing that sort of balances this out? So if the excessive media use is affecting their sleep, or they're not getting enough exercise, yes, I think there's a scope, to support them in shifting that balance. But I think otherwise, in terms of if they're spending much more time online or in front of screens, that is in fact, a common experience in the pandemic. And I think the idea of balancing the quantity and really keeping a close eye on the quality of things that they are, using and accessing is really sort of the key thing to focus on. In terms of family factors, which is sort of the next level, I would just say that communication and parental self-care are sort of the two key things that I'd like to highlight. And communication is one of the most important ways for us to stay connected with our teens and children. It's also sort of fundamentally the way that we make sense of our experiences. We tell stories, sometimes they're quietly inside our brains, but often to each other, to make sense of our experiences, to understand patterns. And for children, really of all ages, learning the words to describe their feelings and experiences, to understand what they are going through, happens in conversations with, caregivers and loved ones and grown-ups and of course, friends. So in terms of how to communicate, what might be some, more helpful tips, for example, I think this is a common question that comes up. And with teens, there are a few things that might be helpful to keep in mind. So first and foremost, I would say that, creating opportunities as part of daily life without expecting or asking too many questions each time you're with your teens can be helpful. And examples of things that parents have shared that can often be useful include things like, it might be on a quiet drive and, going to a grocery store together or running some other errands. It might be if you can, if you have a teen who's helping you out, clear out dishes after dinner. But making sure that there is time during the day where your teen has opportunity, if they want to share things with you, but not always asking them questions so that they don't feel like they're expected to share each time, but just building it into your sort of daily life and routine can be really a powerful way to communicate that you're available to them and there is opportunity to do so. The second thing I would say is that when they do share, our instinct as caregivers is to help them problem solve, help support them, give them the resources they need. And I think that is absolutely on the mark. And just to sort of balance out the idea of giving them space to just share their story, their sense of grief is really key. So I think that there's a space that is necessary for their kind of emotional feelings and needs, as well as a space for problem solving and collaborating with them for problem solving. So I would say, resist, at least initially, the urge to fix it. So it's sort of the classic, don't just do something, sit there. And also recognizing that it might bring up your own sense of kind of grief and a lot of feelings for you. So being able to kind of sit with your feelings and not allowing them to share theirs is a key part of this. Grief and bereavement are huge topics and very central to many people's experiences. And while it's something that I won't go into in my talk, the FFDA team is going to share a link that has some very helpful information that some of my colleagues at MGH have developed that might be helpful to you to look into, which is from the MGH PACT program. When teens do share feelings, I think acknowledging and validating their feelings, validating mean that you don't have to agree with them, but you can validate them still, which is to say that you understand their perspective and why they might be feeling a certain way given what their experience is. And then following that up with reassurance and then collaborating with them for in helping them sort of problem solve it as potential collaborators. By realistic assurance, I mean helping them really think about ways in which or they have access to specific supports. So while our instinct might be to provide a global reassurance to say, I know that things will definitely get better, it's true that things will continue to change and evolve, and right now there's a lot of sign for hope. We also don't, when we give global reassurances, part of what happens is that people feel that what they're worried about is not heard sometimes. And so speaking to the specifics of what our teen is worried about, what our kids are worried about, helping them sort of problem solve after they've had an opportunity to share that emotional sort of experience of it can be helpful and powerful because they really think of their own specific worry being addressed. Lastly, I'd just say that you know your teen best. When I work with children, I really think of it as collaborating with families. I often ask them what has helped them or their families or their teens in the past. And I think that, while there's a lot of obviously importance to knowing some of the statistics and risk factors, we also recognize that each child, even in the same family or in the same situation, is going to respond differently. So again, listening to your teens' experiences, even when you know them pretty well and might in fact be able to predict exactly what they might say or what they might be experiencing, but listening to their unique concerns and their stories is really, really key. In thinking about kind of our own self-care, I would just say that, self-care is not just a way for us to support ourselves. It's also a way to support all of these important lives, especially our teens, but we're often also supporting not just our children, but also often for many of us, elderly family members or parents. You might be the person in your neighborhood that's supporting a friend or someone at school. And teenagers our children are sort of developing internal roadmaps. They're learning to recognize, they're learning how to recognize their own needs, how to care for their needs, and how to seek support when they need it. And some of this happens certainly by talking through things and learning about it both at home and at school. A lot of it happens in nonverbal ways and experiential ways because they see us doing things that we should do to support ourselves, recognizing our needs, caring for ourselves, and seeking support when we need it. So one way that can help you, because as parents, again, my consistent experience is that we are not great about prioritizing our own needs, is to maybe ask ourselves the questions, what would I want my child to do if they were in my shoes? And my guess is that most of us would give a different answer for what we'd want our child to do relative to what we'd often be choosing right now. And so I think self-care is for you, not just because you're worthy of it and because your loved ones depend on you, but because in fact, when you engage in these self-care practices, you are also providing your children with an internal roadmap of what you'd want them to do. Along the way, it is quite likely, certainly at this point in the pandemic, that there have been emotional outbursts, arguments, and ways in which we might have, responded or reactive that we're not feeling great about and are not proud about. But I would just say to us that, being human is certainly a part of this experience, but we can really sort of use that to model self-compassion, forgiveness, and, experientially show our kids ways to repair when disruptions happen. The sort of final piece on this is that I think family rituals around these routines are really, really key. One key example that I can give you is around family meal times. Dinner is often the most predictable time that families get together. There's a whole program called a Family Dinner Project. They have tremendous resources that you can look into. But rituals, very briefly speaking, unlike routines that sort of, give structure to their day, like going to work, brushing our teeth, planning for work, rituals really offer connection and meaning. And a family mealtime, for example, can be, one such ritual where we come together, connect with each other and our teens, and sort of, maybe share what happened in the day. And I think the goal really is to develop family rituals that stay away from conflictual topics, ideally are technology free or limited, maybe an opportunity for your teens to talk about what they are most interested in. Maybe it is the, gaming, the latest gaming kind of app that they're interested in, or music that they're interested in, or something in your own life that you might like to share. I think telling stories about yourself, of challenges, but also of resilience, can all be part of these family rituals. And so I think communication and narratives are one of the most powerful ways to build connection between parents and kids, but also really across generations. So I always like to say that even though pain and suffering is ubiquitous, so is resilience. And building in rituals into your daily lives that allow you the opportunity to communicate with kids and share these narratives of resilience can be really powerful and something we can all do. So I talked, about sort of individual coping skills, about family communication tips and ideas and stories of resilience. The last piece that I will touch upon as I wrap up is about community and policy. And in terms of community, part of this is about building a community and network for ourselves as well as for our children. And that might, of course, be, loved ones, extended family, friends, neighbors, people in school, but also really people you can depend on when, you're struggling as a parent. And at times, really considering whether a medical or mental health professional might be part of this support system. Consistently, keeping that sense of community is key to feeling supported and being able to provide support. And then the other element of building community support, in my experience, is that as much as we sort of, need community and rely on them, even contributing to community well-being is something that helps us feel good about ourselves. And in fact, children are really, of all ages, are really great at it. There's been a lot written about how post, for example, Hurricane Katrina, there were tremendous fundraising efforts, and children were actually at the forefront of this, and raised really tons of money to support, affected families after Katrina. And it really builds both a sense of community, a sense of autonomy, but also feeling like we contributed to someone else's well-being, helps us and our mental health. Speaking to the policy piece, I'll just say that, we often think about schools and, obviously supporting parents, which are all critical. But one of the things that the pandemic has highlighted for us is that already sort of overwhelmed or at capacity health systems, for example, have really now become overwhelmed. And we are fundamentally in a society and in a healthcare system that is very tertiary in nature, meaning that by the time someone seeks care for mental health in particular, they have often been struggling for a long time. And mental health, particularly preventive mental health, is one element that I think we can all sort of advocate for more. And so there are many ways to do this. So part of this can be thinking of ways we can address the stigma associated with mental health. The pandemic, has actually normalized conversations about mental health, and sort of just made this idea that there is no health without mental health a pretty central concept. If you actually think about child development, more than about 50% of mental health problems actually arise by the age of 14, and almost 75% of mental health concerns are often diagnosed by the age of 24. So fundamentally, the point I'm making is that mental health is developmental in nature. And given what we know about the developmental nature of mental health, we know that children and young adults have been one of the most affected in the pandemic. I think there are ways that we need to rethink the way our healthcare systems are currently structured, and advocacy efforts at many different levels that prioritize children, particularly from communities that have been very disproportionately affected. So under-resourced communities, families from racial and ethnic minority communities, and thinking of ways to move forward that center equity are really, really key. My hope is really that the pandemic allows us to think about resilience and recovery, but like in a more equitable and compassionate way. And I'll just say that advocacy does work. Telemental health, although it's not a panacea and does not suit everyone's needs, it does make mental health care more accessible. And in part, telemental health in Massachusetts has now become permanently reimbursable to insurance companies because of such advocacy efforts. There's a lot in the American Rescue Plan that is much more family-centered and invests in schools. And we need to think about ways to advocate that can go beyond one-time emergency efforts, but really think about policy in the longer term as we think about recovery and resilience. With that, I'd like to end by expressing a personal debt of gratitude to teens and young adults who I believe are already leading the way. They have been at the forefront of many, many important political activism, climate, highlighting the emerging climate crisis. And to me, I have to say, I actually became a psychologist because I love working with kids. They give me so much hope. And so I feel a personal debt of gratitude to teens and young adults, as well as to the families that support them. So thank you so much for listening. And with that, I'll hand it back to Susan.
Well, you certainly gave us a whole lot to be thinking about, and I am appreciative of that. Just get this going here. Oh my God, Susan, just when I thought I had it right. Thank you, Archana. And the stuff about the caregiver self-care, I think, is just really central to what we do at Families for Depression Awareness. And we often say you can't pour from an empty cup. So you got to make sure that you are replenishing yourself. You got to balance giving of yourself with giving to yourself. We would not be able to do these programs without the support of people like Dr. Basu, who so generously share their time and expertise, but also the funders who support our work. And for our teen depression program, that includes Gene Site, the Massachusetts Department of Public Health, the Massachusetts Community Health Network Area 17, the George Harrington Trust, Middlesex Savings Charitable Foundation, Rebecca Pomeroy Foundation, Thomas Anthony Pappas Charitable Foundation, the Adelaide Breed Foundation, and the John Donnelly Trust. Also, as I mentioned at the outset, our programs are made possible because of generous contributions of people like you. We are grateful, and we appreciate it all. I'm going to jump over the Q&A slide just so that you all can, if you need to hop off, you have the link here that you can access the survey and be entered for a chance to win The Still Quiet Place by Amy Saltzman. And there's a couple more links up there that you may find of interest, and I encourage you to take advantage of them. We got a whole lot of questions, and fortunately, a bunch of them fall into a couple of categories. And it seems to me that one of the real overriding concerns for parents right now is about respecting their kids' needs for mental health support with expectations of their role within the family.
Mhm.
And with school. Like if a kid is showing signs of depression, what kinds of expectations are reasonable for a parent to have about academics, about chores, and also how to make it so that it's not nagging, but how do you change that into being supportive? There you go. There's an easy question for you.
I think that you have hit upon sort of a very central question that's, it's really common. And I think sometimes it's challenging to talk in broad strokes because obviously the answer looks different for each family. However, I guess, this to me is fundamentally a developmental challenge, right? Which is how much do you allow, how do you promote autonomy and let your teen lead the way, while also recognizing that they might be struggling, especially right now, and wanting to support them and sort of, problem solve. And I guess there's a couple of key things we can talk about. One is the idea that certainly if there are significant changes in mood, behavior, academic functioning relative to, how your child has been doing, over many months or pre-pandemic. I do think, thinking about professional support is key. And I will just say having a flexible idea about what that mental health support can look like is important. So most people think therapy is going to be very long-term, weekly therapy. It's time intensive, although now with virtual and remote, that we are saved that sort of time often. But I think it's certainly an evaluation or screening can be helpful if you're noticing some of those, symptoms and behaviors that we talked about earlier. That being said, I will say that, even as schools are reopening, vaccines are scaling up. Yes, we're returning back to school, but we're not returning back. Like the pandemic is still going on. We're not trying to catch up necessarily on lost time. We're actually just trying to normalize sort of where things are right now. And I think that is going to take time. So certainly recognizing when additional professional support is needed is one element. Allowing space and time for things to normalize as schools reopen. And, I think there's something about this very hard winter, like recovering from that, giving them space for that. But I also think that allowing, communication, which is to hear that story from your teen about what they think is bothering them the most. What is the piece that they might most like to invite help for, is probably key. I think the idea of collaborating to kind of find common ground is perhaps the starting place. That's the place we can join together, even though there might be areas that, some parents are often more worried about than, say, teens. But finding the common ground, allowing their story to unfold. And I think a piece of this is also about really our capacity as parents to tolerate the feelings it brings up for us, the worries about our children's, mental health, education, that, resist that urge to sort of hug them, which is a good one and definitely recommended, but the urge to sort of fix it immediately. But allowing a little bit more space so that they might unfold and create their story, including the story of how to get help. I think that's kind of the dance over here, if you will.
I'm just so happy because the way you answered that, I think you answered about 12 questions. And I think it's really important about helping kids figure out that they need help, because they need to come to that decision for them to be able to accept it.
Exactly right.
We know that often depression runs in families. Someone asked if you have any tips on breaking generational depression.
That's a really important question. And I mean, I would say that part of that is certainly seeking help both for ourselves as parents, as well as for our teens. And, I think just the idea that a, parent or caregiver has asked that question speaks to me, tells me that they are willing to have that conversation in their families with providers, with their teens, that, look, we know that this runs in our family. We know that you might be at a, greater risk for experiencing depression. And we know that there are tools available to help and support us. Right. And if many of us have actually often sought help much later than we perhaps in hindsight would have liked to. And I think even being able to share that, just say, I wish I had done it, and here's my part of the story, but maybe this can be a shift in your narrative of how you may not experience some of the challenges that I did. So I think, again, the idea of making that conversation transparent takes away the power of the stigma that's often associated with mental health, and makes the teen feel connected and not alone. I mean, fundamentally, communication allows our kids to not feel alone with their worries.
And I also think that developing and modeling those healthy habits, which we often refer to as SEAM, for sleep, exercise, eating, and mindfulness,
Yep.
that in itself speaks to an awareness about one's mental health and well-being.
Absolutely.
We got a question about for families in the military. Many of them have had to relocate during the pandemic, and they have kids and teens. Are there any tips that you have for helping them to deal with this sort of dislocation and relocation?
Yeah, this is it's a really great question. So there are, elements that are unique to military families. Actually, when the pandemic started, I worked with a team that works with military families, and we were talking about their pandemic experience. And one of the things that this particular mother shared was that she felt so supported because military families often have that sense of community and structure that's built in. But I think it also comes with some unique challenges, such as, transferring, from place to place, and that sense of physical predictability not always sort of being there. And this is where I think family rituals can be particularly powerful. So one of the things is, of course, communicating, helping our kids anticipate and understand what changes are going to be coming up. And then the other piece is, even when there isn't physical continuity, there can be psychological continuity. And that can come from family rituals. So I talked about the family dinner project as one example. But this is also this is a time when we have spent way more time with our family members than perhaps we ever imagined that we would. It does provide us with unique opportunities to develop family rituals, whether it is perhaps sharing something we are grateful for when we sit together for dinner, whether it's a tradition of sharing different, music that we like. But the idea of creating rituals, as I said, creates connection, meaning, and predictability. And that is a sense of psychological predictability that we can provide our kids, even if we're moving from place to place, which of course can be, somewhat disruptive.
And also in the military, there are varying levels of stigma.
Yes.
Because it can threaten one's livelihood and identity. So I think that's a very difficult tightrope that people walk. As you talk about these rituals, it makes me think, because someone asked, how do you bring a bit of fun to family time despite these restrictions? And I think that in a way you've answered that. I mean, not all the rituals need to be serious. Family game night or, anyway.
Yes. Yeah. And in fact, I would say that especially if you're worried about your teenager not talking as much, there are areas like maybe it's about school or about some particular friendships that have been kind of more high conflict. I would actually say intentionally choosing rituals and times, like meal times is one, but they could be certainly other times that are one of the rules might be that you avoid conflictual topics. So really connecting at a place where you can both be sort of emotionally open and joyful and like enjoy that time together is essential to keeping that sense of connection alive. So yes, I'm all for non-serious rituals are definitely the way to go.
Uh, do you have anything to say about the connection between nutrition and or vitamin D with depression?
Yeah, I had that sort of thought about saying something about nutrition. So, it's not an area that I research, but, we definitely know that nutrition and including sort of, vitamin D among other types of, nutritional, aspects of food and are really, really important, right? And there's sort of 2 to 3 elements of it. One is the type of food we eat actually, affects our physical health and also affects us emotionally. I think there are rituals around food, which is sort of the more behavioral elements that matter as well. And I think there's some emerging line of research about how nutrition affects our gut microbiome, which is also something that affects, mental health. So I would say that I think there's probably a lot more that can be said about nutrition, and that this might be a question, that you might explore with your teen's primary care provider. I would be reluctant to give any nutritional advice or to recommend any particular diets for sure. But I do think that nutrition and food habits, each of those elements are pretty key to mental health and physical health.
Thank you. And obviously school is looming for people, whether it's that they're hybrid or, going to go back or are back or whatever. And this has really raised for me that different kids are definitely in different situations, because I have heard from some families where the kids are grateful to be able to work from home, to do their school from home, because school has things that are either unsafe for them or provoke unhappiness or whatever. And others just might just have anxiety about going back. Could you just talk a little bit more about how we can meet our kids' needs, whatever those happen to be, as they make these shifts back to the normal of the day?
Again, I think in your question is inherent sort of, that idea of normalizing that each of our kids is going to have the return experience, as with the pandemic experience, is going to vary a lot. I think, unfortunately, in most conversations in the public forum, learning and mental health, like so staying at home and mental health suffering, and being in school and mental health being great, that's sort of the way the debate has sort of been framed. But I don't think that's really the reality. And I think it's true that a small but important number of children have found that the remote or hybrid experience has actually worked well for them. It could be because of concerns about school, about anxiety, about bullying, or because I work with kids and families where someone might have a significant physical health issue that might put them at a greater risk, and so they're just might feel much more safe learning from home. But I think the point that I'd like to highlight is as we return back to school, school might be reopening, but emotionally, we are still, that sort of, there will be a period of readjustment. And I think one of the most powerful things we can do is to keep that in mind as we, think about schooling, which is to say that we shouldn't be expecting our teens to, bounce back in terms of their academic learning or, trying to catch up with whatever period of time that's been lost. It is going to be a process that's going to vary from, each child to each child. I actually have to say that this is one time, because this is a collective experience, where schools and teachers are also incredibly mindful and aware of this. And I think that school systems and academic institutions have been particularly flexible around this, as we see in terms of changes to standardized testing, for example. So I would say, in fact, given that not only is the pandemic not over, but given what we know about how the virus might, be endemic, which is sort of what epidemiologists are predicting, some amount of caution and anxiety before we can trust that it is safe is going to take time. And sort of following our child's lead and listening to, again, their story and their experience is going to be key to supporting them as they go back.
And I think we each are where we are now, and we need to find our own way forward. Our final question for this evening. How can I help my teen have hope for the future after living through a pandemic?
Well, it's a really important question. I think there isn't a parent who's not thinking about that in some way. And there are many ways to answer it, but fundamentally, I think this is about the fact that as much as we have seen the disability and loss and trauma that we've all experienced, we have also seen extraordinary efforts of compassion, of support, of efforts that have led to scientific advancement, really extraordinary efforts of support. And I think that is one of the things we can do for our kids is tell them stories that recognize, obviously, the emotional and physical experiences of loss and stress, but also highlight for them the ways in which people have risen to to this moment, to this experience, to help it, be better for all of us. And this is not unique to this pandemic, right? If you look in history, even in our own personal history, outside of a pandemic, I'm pretty sure that most of us can think of periods of really tremendous challenge where there has been ways in which we have adapted or shifted our stance or, relied on community support to find our way forward. I think many of us actually had heard that story from our parents and grandparents. Every family in every generation has a story of resilience, which includes something challenging and something that involves pain and suffering, but also a way to move forward. And I think what we can do is bring our mindful and intentional awareness to that sense of growth and that tremendous sort of effort and outpouring, because I think that's what gives us hope, right? Whether it's scientific advancement, whether it's destigmatizing mental health, whether it's advocating for health resources, that's what gives us hope.
Hear, hear. Dr. Breslin, you've been wonderful. Thank you so much for all your time and sharing that wealth of information. We're extremely grateful. I'd also like to give a shout out to the FFDA team for all their work on the back end, answering questions and helping people out and helping me out. And also just to you all, thank you so much for spending your time with us, and go to our website and learn more. Hope everyone has.
Thank you so much for having me.
It was our pleasure. Thank you so much, everybody. Take good care.
Good night.